This is a safe space. I am K Vet. A couple weeks ago, I posted a video, story time, titled My Shocking Truth, and I revealed having my very first mammogram in December 2024 and the results after having that mammogram. I pinned that video in the comments, so if you haven't had a chance to view that actual video, I encourage you to do so. This is part two. Just an overview from the first video. Had my first mammogram ever in December of 2024. The results came back a little funky. Ended up being diagnosed with DCIS, which is ductal carcinoma in situ, and it's a very early stage of breast cancer. And I have it in my right breast milk duct area. Um, since then, I've had two biopsies in my right breast. I've had one biopsy in the left breast. Um, I had an MRI, and the MRI picked up something very subtle in the left breast that the mammogram did not pick up. Therefore, I had to end up having a biopsy in my left breast, which came back to be benign. But still, it raised a little concern that as I get older, it could pose a threat to becoming cancerous. Now, after getting the results of the right breast, I have done, a lot of research and trying to understand this particular diagnosis. And I decided if I had to have a mastectomy, which would be removing the breast, I would prefer to have a double mastectomy and just have both breasts removed. That way I wouldn't have to deal with this if I get older and something happens in the left breast, and just take care of both of them at the same time. So now I'm at this point. I am scheduled for surgery January 27th, 2025, and I am scheduled for a double mastectomy. And a double mastectomy basically means I am having both of my breasts removed. Both of my breasts removed. So I had options for reconstructive surgery. So I was scheduled to meet with a reconstructive surgeon at the Midwest location. Here we go. So I have finally met with this surgeon, and I just wanted to get a better understanding of the options available. So I was pretty certain that I did not want to have the silicone implants, just more concerned about foreign objects inserted in my body and infection, longer healing time after the mastectomy procedure. Now, the silicone option would actually take about an hour, but it's kind of like a process over a short period of time. Directly after my oncologist does the mastectomy part, this surgeon would come in and he would take over as far as the reconstruction. So the first process would be having saline injected into the breasts to fill them and kind of start prepping and stretching the skin, preparing the skin for the implants. I don't want to do implants, so we're not doing that. I was more interested in using my own skin for breast reconstruction, which is also an option that is available. So that's what I needed more clarification on. Now, this was explained to me by the reconstructive surgeon. So It is definitely more of a natural way, but it is a major surgery. And what it entails is they will take skin from the right and left side of my lower abdomen area. That skin would then go through a process. They would have to test the tissue to make sure everything is okay for it to be implanted into my chest. I would have surgery in the chest area, and that tissue from my lower stomach area would then have to be, I would have to be cut in the chest area. That tissue would have to be connected to arteries and blood vessels in my chest area. Of course, every procedure, there is some form of risk, possibly. So if I was to have a blood clot or some complication, then having a blood clot could kill the tissue of my own tissue. It could kill that tissue. And if I had to have like an emergency surgery, if that was to happen, they would then have to take fat from my back area and shift it around to the front area to reconstruct um, the breast again. This whole procedure with using your own skin is 10 plus hours. It is a major surgery. And I would have tubes on the left and right side of my stomach, as well as a tube on the left and right side of my chest. These are drainage tubes, and these are tubes that would drain any excess fluid. Then there's a recovery time in the hospital of 5 to 7 days. I'm not doing that. I'm not doing that. No, no, thank you. No, thank you. Um, I can't do that. I can't do that. So, my only option is to just go flat and heal, and then I can visit a boutique. We have a boutique here in the Midwest that's basically caters to cancer patients, and they have all sorts of supplies. So I'm just thinking more of, they have bras, and you can actually purchase prosthesis that fill the bra. So if you have to go out, wear clothes, dress, shirts, or whatever, it looks like you have breasts. And really, nobody knows the difference unless you have told them or they know you have had actual mastectomy. So I'm just going to go that route. So I just kind of wanted to follow up with that story, that yes, I did get to see and speak with the reconstructive surgeon. And I actually asked him what he thought, what his opinion was as far as reconstructive surgery. And I wanted to know, um, does he see many women who choose to just go flat? And his response was yes, more women are deciding to just go flat and not have any reconstructive surgery because they're more concerned with getting an infection. So, more women nowadays are basically choosing to go flat. Now, I think if this was happening to me and I was in like my 20s or 30s, then the possibility of having the silicone implant, I would probably be more prone to do that. But I'm in my early 50s. So, and then the maintenance of the silicone, it's like a 10-year shelf life. So around 10 years, you actually have to go back and have that silicone replaced. The silicone could leak, it could get punctured and leak, which would not be good. And I'm telling you now, I'm too rough. Like, I have two boys. I have two boys. One's 23. My other son is 11. You know, I nursed my first son for 12 months. I nursed my second son for 15 months. I was 30, turning 30 when I had my first child. I was 40 when I had my second. So 52 now. So that's the reason why I was just having my very first mammogram December of 2024 at 52 years old. So I'm going to cut my losses and I'm not going to do any reconstructive surgery. I just want to get this mastectomy over with and heal. But what I would like is just if you viewing this video, if you know anyone or if you have had this experience after having a mammogram, I would like to know opinions, what people actually think about reconstructive surgery. I don't have a lot of time. My surgery is already scheduled for January 27th. I'll be going under and the boobs are coming off. Um, how I'm feeling is I'm just ready to do this and get it over with so I can move on with my life. I don't know how this is going to affect me. I don't know how I'm going to feel after all this. I don't know how this mentally, how this is going to affect me. I do not know. I'll have to wait till this is all over and I'm in the healing process and just over time, just kind of see what happens. So at this point, I'm feeling good and I'm ready to do this. So leave your comments, send your prayers for your girl, and let me know what you think. That's it. That's all.